Hey mama, are you ready for a pelvic floor strengthening workout? Okay, so this is going to have about 8 different exercises, and it's up to you to choose if you want to do 1, 2, or 3 rounds of it. And if you're looking for any other resources to help you with pelvic floor issues, or if you have diastasis recti, make sure to check the description below because I have a lot of freebies for you. And if you enjoy these, make sure you subscribe and hit the bell notification so you won't miss anything. Also, make sure to only do what feels safe for you. Okay, you take care of your body. Always listen to your body, do what it's telling you. If you ever feel uncomfortable, just stop and modify, okay? All right, so let's get going. Okay, here's your pelvic floor strengthening number 1. All you're gonna need is a pillow or a ball, okay? We're not even gonna be standing up on this one. And we are gonna set our timer to about 1 minute and 10 seconds, okay? So you're gonna sit, Indian style, and we're just gonna do some breath work. So here we go. You're gonna breathe in with your diaphragm, okay? And then when you exhale, or lift your pelvic floor, engage your TVA, okay? Breathe in and out. Really lift the pelvic floor up, okay? And breathe in with your diaphragm and relax everything, okay? I want you to think that you're picking up a grape with your pelvic floor. Think about that when you breathe out. Okay? Now breathe in and out. If you've seen some of my extended extended breath work, you will know what I'm talking about when we do these, okay? So breathe in and out. And in and out. Okay, so now we're gonna do that same thing, but we're gonna lay down, okay? Just like this. And here we go. I want you to breathe in with your diaphragm. You feel it push on your pelvic floor, and then breathe out. Lift your pelvic floor. If you feel that engagement of your TVA, that's awesome. Breathe in and out. Lift that pelvic floor, engage your TVA. Breathe in, release everything, and out. Now this pelvic floor strengthening is part, keep breathing, of a 30-day pelvic floor challenge I have in my Fit Tabulous Moms Club. I can link that below this video. And breathe in and out. Lift that pelvic floor, engage your TVA, okay? And in and out. Okay. So now I want you to take your toes in. I like to have my little paper to show me what we're doing. I want you to sit up, okay? Put your toes together, put your ball or your pillow between your knees, okay? And you're just gonna squeeze it, all right? So let me get this started. Okay, and just sit here and squeeze when you breathe out. Lift your pelvic floor when you breathe out and squeeze the pillow. Okay, and in, breathe in, relax, and out. Make sure you're not hunched over like this, okay? I want you to sit up, use your legs for support. If you can come back, if you have diastasis recti and you haven't worked on healing it, this could make you cone or bulge. So you want to sit up however it feels comfortable for you. And in and out. Lift that pelvic floor, engage the TVA. Breathe in, let everything go, and then out. Okay, in and out. In and out. Okay, so if you're a little confused on the breath work, I have a 5-day diastasis challenge that's free that you can see below this video, or also in my Fabulous Moms Club. All my programs are in there. You will know exactly how to do, and I'll explain everything in there, okay? So I want you to sit up this time with your heels together, touching, okay? And I want you still to support yourself. Come back as far as you can without doming or coning. If you don't have diastasis recti, you don't have to worry about that. But you still want to, have everything engaged. So breathe in. Let your pelvic floor go and out. When you breathe out, I really want you to squeeze those heels together. Lift pelvic floor. Breathe in and out. In and out. In and out. When you learn how to work these 4 inner core muscles together with your diaphragm and your pelvic floor, this helps your core all the way around, low back pain, leakage, diastasis. Now come up if you need to come up. Remember to squeeze those heels. When you do a breath, it really helps engage everything, okay? And breathe in. And when you breathe in, I want you to let everything go. So real quick, let's practice that while I'm not on the timer. Let your belly go. Relax your pelvic floor when you breathe in, and let it go, okay? Balance is very important. Okay, now we're gonna put the ball or the pillow between our legs, okay? And then we're gonna bridge up, alrighty? And here we go. When you come up, I want you to squeeze that pillow or that ball. Come down and breathe in, and breathe in and out. Breathe in and out. Squeeze that pillow. In and out. Really relax your shoulders and your jaws here. We only want to work on this pelvic floor core area. Breathe in and out. In and out. And in and out. Squeeze, squeeze, squeeze. Breathe in. Okay. So now what we're gonna do is we're gonna stay up. Here we go. And we're gonna pulse. So little pulses, and when you pulse up, you're squeezing. Keep everything engaged. And every time you squeeze, I want you to lift that pelvic floor a little higher. Okay? So it's like you are picking up a grape. You might be a little sore. It is very important that you don't just focus on pelvic floor lifts or Kegels. You want to make sure that you also breathe in and lengthen your pelvic floor if you deal with leakage, low back pain, diastasis, things like that. prolapse, pelvic floor dysfunction, you really just want to, and make sure you're still doing your breath work while I'm talking. Okay? You really want to make sure that you lengthen and strengthen. That is a huge part of healing your body, okay? Because most of us have an overactive pelvic floor. All right, so now this is our last one we're gonna do. And we're gonna bridge up and kind of circle our hips. So it's, so on the up, on this side, breathe out, and then breathe in here. And out, in. Okay. See what time we've got. All right, so now I want you to reverse it. So this is working your glutes and your pelvic floor also, and I always say the glutes and the pelvic floor are BFFs. It's very important to work those together. All right. So these are like bridging circles. Bridging hip circles. Okay, so what I recommend you do is probably do 2 to 3 rounds of these, so you're gonna rewind me and do it all over again. I hope you enjoyed that pelvic floor strengthening little circuit, okay? I would also love it if you would like and share this. Give it a thumbs up if you liked it, and share it if you know anybody who would like this. Also, feel free to leave any comments and questions below. And if you want more of these, make sure to subscribe and to hit the bell notification so you don't miss anything, okay? Also, make sure to check my freebies down below, and I will talk to you soon. Bye.